And our guest is Angelia Foster. She is the Chief Administrative Officer with Marshfield Medical Center, Beaver Dam, reporting upwards of 90% capacity now for the past couple weeks. A stressful situation for healthcare workers in Beaver Dam, in Dodge County, in the state of Wisconsin, and the United States. And we're not alone, but unfortunately, we do seem to be posting some of the highest numbers on the planet right now here in the United States, and it's taking its toll on healthcare workers. If you're just joining us, Angelia was asking our listeners if they could do some simple things: wear a mask in public to show your support for healthcare workers. Um, and you too on the administrative side of things. I know that you guys are probably trying to do everything you can for workers in your facility who are going through all this.
We are. The greatest thing we could give them would be more clinical resources. But as you mentioned, 45 states in the United States right now are seeing the same kind of numbers that we're seeing. So the additional resources simply are not available. So what can we do to help, right? So we are doing some team nursing where we kind of have nurses and then we give them other resources to be their runners or to restock or do things that really are tasks that others can do in order to give them the greatest support that they need in the roles that they're doing. Additionally, we have really tried to look at, especially as we're going into the holiday season, how do we help our staff who are now agreeing sometimes to work 16 hours at a time? How do we help make their home life a little bit easier, especially as we get ready for the holidays? So our nutrition and foods team actually is doing a Thanksgiving take and bake. So they can place an order, get turkey, gravy, all the fixings, and be able to take it, pick it up, take it home, warm it up, and not have to worry about planning a large menu. And I, for one, am taking advantage of that this year because I will intend to be here the day before and be here for part of the day of Thanksgiving. And that little reprieve is a nice option. Additionally, we have concierge services that are going to be starting shortly, where members of the community have stepped up to help us. So car repair, saying, hey, if you need an oil change, we'll come pick it up at the hospital for you. Take it, change your oil and then bring the car back while you're at work. So we're looking for anything and everything we can do to make it easier on the staff. Things like we have a couple of businesses in town who have stepped up and said, would you like for us to wrap your Christmas gifts? If they bring them, if you drop them off and give us a day or two, we'll get them all wrapped and return them back to them. So that's one less thing that the staff's working on top of the work that they're doing here inside the facility. So we're just trying to, however we can, find ways to lighten their load. I think the more important thing is if you have a friend who works in healthcare, call and check on them or text them, right? These are exhausting days. And there are days that I can't even pick up the phone and call a friend who I know is going through a hard time, but I could send a quick text of encouragement or just a quick, how you doing? How's your family doing? And also thank the family members of those who are our healthcare heroes. Kids are not getting to see their mom and dad as much because they're here at the hospital. And probably when they go home, they're a little edgy. And so be sure to check in on those spouses and kids of healthcare workers to give them support that we really admire what your mom or dad is doing.
A little encouragement from the community goes a long way, it sounds like.
It does. And so in the spring, we had lots of encouragement. We had meals being dropped off, snacks being dropped off, lots of sidewalk chalk. But this has been a long haul. And truthfully, the numbers and the experiences of the spring are much more compounded now when we see the numbers skyrocketing the way they are. And we've had some members of the community stop by and put new sidewalk chalk outside our entrances. And it's meant so much to the staff. It's just after a really long day to walk outside and see a note that says, thank you for being our healthcare heroes is huge. We've also had members of the community step up and say, listen, I can't come and help, but can I forward a meal? Can I drop off or can I order pizza for the staff? And if someone's interested in doing that, they can call 920-887-1181 and ask for administration, and we'll coordinate that on your behalf. The staff food is always a good thing. We would just ask that it be pre-made so that we avoid any potential foodborne issues. But we've had pizza, subs, we've had cookies delivered. Thank you so much to the community for all you're doing to show that level of support.
I've been asking a lot about the healthcare professionals over at Marshfield Medical Center and how they're doing. You don't just have healthcare professionals staffing that place. How is everybody? I mean, maybe that's a question I should have asked earlier. How is the folks that are in food services, as you just mentioned, all the other people that keep that place going? Are they feeling this impact as well?
They are. And so the number of staff that are off often impact those that are in the non-clinical roles, right? Those who serve in nutrition and foods or environmental services, or patient accounts who help to manage your bill when you call. And we've had to redeploy 60 of our staff members to new teams, new times, new shifts, new positions in order to meet the needs. So we have folks who are not traditionally environmental services, actually cleaning to help keep us safe and keep the facility safe, and taking them out of other work to be able to do that. So it's very taxing on all of the employees. What I'm most impressed with, though, is when you ask them, what can I do for you today? Or what's your greatest challenge today? They're always deferring to their colleagues, and they'll say, oh, I don't have it so bad where I work. Please look after those who are helping at the bedside, or please look after those who are cleaning the rooms. And so they have a selfless spirit that is second to none. And it's my great privilege to get to work with them and watch them do that very important work, regardless of whether it's right at the bedside or helping us get people ready for right at the bedside.
920-885-4446. Again, the phone number if you've got a question for Marshfield Medical Center, Beaver Dam Chief Administrative Officer Angelia Foster. Again, at upwards of 90% capacity over the past couple weeks, what types of treatments are being undertaken with the individuals in your care? Are there any new treatments that are showing promise that you guys are administering that might be showing some signs of positivity? Anything we should know about there?
So there are, of course, right, this is a new virus, and so there's lots we're learning. So we get very excited when we hear of new opportunities to clinically care for our patients. Remdesivir is one that's been used in the last few months. There's a new one, and I always butcher the name, a new medication that can be used in outpatient settings that we just recently have received and are working through how and where do we administer it, who do we give it to. We really look to our ER providers and to our hospitalists. Those are the doctors who actually work in the hospital on a daily basis to build that plan of care and look for what makes sense. We know that we've learned a lot in 7 months with the disease. I think we're now up to 8 months in full disclosure, but there's lots more that we're still learning. And so every new opportunity to treat a patient so that they can recover is one that we're going to pursue.
How are you feeling about the news that we're hearing about potential vaccines on a couple different fronts at this point from a couple different companies?
So we want to make sure that, of course, any vaccine that comes to market has efficacy and is working. And so these new developments in the last week or so are things that have us very hopeful. We want to make sure that we have the distribution plan in place to be able to get it to those most needed. Healthcare workers need to be immunized, those in long-term care facilities. So first responders. So there will be some initial, right, when the vaccine comes out, it won't be widely available right off the gate, but we'll have to prioritize who and how it's dispensed. But we're hopeful that in the springtime, there'll be more and more of us who can make the decision to be vaccinated and do what we can to protect each other. I don't know about you, but it kind of seems like that's a great hope and something to look forward to in this really dark winter that we're facing.
920-885-4446. Again, the phone number if you've got a question for Angelia Foster with Marshfield Medical Center, Beaver Dam. How has this whole experience changed things at the facility you're at? Is it are there silver linings in here anywhere? Are there things that we're learning now that can be applied to the future? Where are we at?
Yes. Well, so I don't know if you know, but I arrived here March the 2nd as the new Chief Administrative Officer. And within 10 days, we were in full-blown incident command for COVID. And this is my first time as a CAO of an organization. I've served in other capacity, but I remember calling my husband in that first week going, holy cow, this is something totally different than anything I thought I was getting myself into. What I can share with you is I think in terms of what it's doing to our industry, it's making us be innovative. Telehealth has been around for a very long time, and none of us really wanted to adopt it because we've always felt like that human touch, right? That ability to see in person our provider was what we preferred. I think the outside of COVID, when we get to the new normal of whatever this looks like in the coming years and months, I think telehealth is a great option. And we're actually working really hard to provide telehealth. One of the challenges in Dodge County is not everybody has access to broadband. So we're looking at telehealth cards at some of our locations where we know broadband's an issue. So even if somebody doesn't have that access via their smartphone, they could come into a very clean, close facility to their home, be able to see a doctor over telehealth resources, and be able to get the care that they need. So I think that innovative and silver lining is going to be a good thing. The other thing I will share with you is, as a new leader to this organization, I've learned just how amazing Beaver Dam is. The people who I get to work with every day are some of the smartest, most compassionate, kind, generous, selfless people I've ever met. And I am so glad I said yes to this job and to the opportunity to watch them do their work. And so I think there's a silver lining there too. I also think even in my personal life, right? I think many times we've spent our lives filling it with things that weren't as important as being with our family. And I've enjoyed being able to, on the weekends, really disconnect and be with my husband and my son and my daughter and my grandson. Those are really important things that I hope everyone else is taking the time to do as well. Just, it's okay to lean into your family a little more and lean out of what the world is offering to us right now.
You know, it seems like the telehealth option very closely mirrors what we've, or at least most of us, have come to discover from the video conferencing apps in
Yes,
general, the
yes,
Zooms and the whatnot. It's kind of forced us to put something in place that we didn't maybe plan on putting into place, but now that we have, we're realizing the benefits there. It seems like with telehealth, there might be people who would be reluctant to go to a doctor for something, but since they don't have to go through all the trouble
right?
of maybe not trouble, but go through that whole process
That's right.
of going to a physical facility, that could benefit people
Yes,
potentially in the long run. I
yes,
mean, that's an industry shaking,
right.
industry changing
That's right.
situation.
And I think for us in Beaver Dam, it just widens the door for us relative to specialists, right? There are some things we don't have here locally, but we could use telehealth to bring it to our community so that you don't even have to get out of your pajamas in order to see a cardiologist. Not a bad gig, right? I'm certain the cardiologist would say we need to be out of our pajamas and exercising a little bit. But I do think that we'll be able to bring specialists to town that perhaps we haven't had in the past, and we'll be able to do it from the comfort of folks' homes. And I don't know about you, but sometimes just that feeling of being at home makes it easier for me to be able to be kind of transparent about, well, maybe I haven't been eating as well. Not that I'm sharing anything too personal, but in the midst of COVID and the pandemic, we all are probably challenged a little bit with what we're eating and how much exercise we're getting. And so being able to use telehealth to have those kinds of conversations with your doctor, hopefully will help people to feel more empowered around their health.
And we've heard, or at least I've been reading about mental health and the effects that
Yes,
telehealth has had on that. It's made people more comfortable to share
yes,
to get into some of their emotional issues, which has had a positive effect there as well.
yes. And telehealth really can be a nice complement to behavioral health. I also think for many folks who have behavioral health and might be on medication, it's also a great way to check in with their psychiatrist or with their therapist. So we would encourage folks to continue to use that as a resource as well. But you're right, it's a little more comforting. I don't know, sometimes it's safer to be able to say it over a video conference and say it in person.
So something we may continue to see even after
Yes,
hopefully this is long in our rear view
yes.
mirror. Um,
Especially given that behavioral health is in such short supply across the country, the leveraging of behavioral health and telehealth will be a huge win for us as a country.
hmm. And well, I don't know if we want to go down that rabbit hole too much, but kind of to bring it back around to the reason that we're speaking today, the pandemic and the things that we're seeing, those kind of harkening back to the first segment when we were talking about people in the hospital that are experiencing these symptoms in their more extreme form. Could you give us some insight, a suggestion on when you think people should make that decision to go to the hospital with these symptoms?
I would say if you are running a fever, if you look at the COVID symptoms, there's a variety. Cough, fever, right? There's some GI symptoms that come along with it. I would encourage you, call your doctor. They're going to be the best person to be able to direct your plan of care. So if you call in and you give them your symptoms and they say, well, Angelia, it seems like based on what I know of you, it's probably seasonal allergies. That's one plan of treatment. But also if they saw symptoms that they were concerned about, they would direct me to the ER or to the urgent care. Our volumes in the ER have continued to grow as people are having needs, and we're here to take care of them. But I would certainly encourage you to start with your primary care. And if you don't have that, then reach out to us and we can help get you connected to one. Call that 920-887-1181 number and say, I don't have a doctor, but I'd like to be connected to someone, your COVID line, where they could help me find a doctor and someone to talk to about my symptoms. We know that that's the best course of action, is work with your doctor and figure out what's the next step you need to take. Many of us will have some symptoms, but the best plan for us after talking with our doctor will be to quarantine at home. And that's hard to do, but we need you to do it. It helps us not to spread it to others and helps us to make sure that we're doing everything we can to keep as many people safe from the virus.
920-885-4446, the phone number if you've got a question for Angelia Foster, the Chief Administrative Officer with Marshfield Medical Center, Beaver Dam. We'll go to the phones again. And again, I will relay the question to her because of our technological limitation. Apologies for that. We'll go to the phones and say good afternoon. Welcome to Community Comment. Okay. Thank you very much for that question. We do appreciate it. And the question is about Overflow. You're at right around 90% capacity. You've been there for a couple of weeks. And God forbid we cross that line into even more serious territory. What is the plan with not just Overflow but staffing shortages? Are you in contact with local hospitals in the area? Is the next step going to the State Fair Park scenario? What does that look like?
Yeah, so the alternative care facility is great in theory, but you have to remember there's a couple of things related to that. The patient has typically already been here, and it is a recovery plan for them. And they have to agree to go. And not everyone's willing to go over to the alternative care facility. And the criteria is intended more toward those trying to recover than those who are acutely ill. In terms of Overflow, we are part of Marshfield Clinic Health System. There are 9 facilities across the state, so we're trying to leverage each other. We're trying to leverage each other in terms of staffing. Beaver Dam was hit hardest and first, and now our colleagues up north are experiencing what we were experiencing a few weeks ago. And so we are working together to try to make sure we have enough staffing to meet all the needs. I will tell you, though, that I have concerns across our region. I think many hospitals have stopped performing elective procedures because they've had to reallocate their resources to the hardest hit and greatest need areas of their hospital. And I do think potentially if we don't figure out a way to bend the curve and to do what we can, we may have moments where we're not in a position to care for everyone who's sick. And what I know for sure is COVID is running rampant, but heart attacks are still going to happen. Strokes are still going to happen, and those folks are going to need care. So I need for as many of us as possible to take care of ourselves, to kind of live up to our obligation to look after each other and wear our mask and do what we can to prevent the spread so that we aren't overrun and in a position that somebody who really needs our services wouldn't be able to access them.
920-885-4446 is that phone number. We should be able to squeeze one more call in here before the end of the program. We'll say good afternoon. Welcome to Community Comment. Interesting question. Thank you very much for that. We appreciate it. We have a scenario here that's probably very common among a number of people that have gone to get a test. In this case, one of our listeners went to the testing site in Mayville, which I believe is Mondays and Wednesdays, if I'm not mistaken. They're at the Highway Shop in Mayville. I apologize, I don't have that information right in front of me. And the question there, she's waiting for that text to come to see if she's going to be positive or negative. Is there a way to perhaps expedite that process? Is My Chart, which is gaining a lot of popularity? I know we're on My Chart now, and folks are liking that. Is that an avenue that might provide a faster route to finding out what those results might be, rather than making somebody send that text message out?
Yeah, so a couple of things. First, on the National Guard that's currently leveraging that Mayville garage, starting next week, they'll be using a facility in downtown Beaver Dam. I think y'all call it the Bassett building here. And it will be a walk-in facility, I believe, starting on the 23rd. And they'll have hours of 10 to 6 to be able to meet the needs that are here in Beaver Dam. So that's exciting for us. And we're glad to partner with the National Guard, with Public Health, and with the Emergency Management Department here in Dodge County. In terms of results, I wish I could tell you that you could get them sooner. The system is taxed. We at Marshfield Clinic have our own reference lab that on average is doing 11 to 12,000 tests a week. Just COVID, never mind all the other illnesses people have that might need that testing. And so you can use the portals for your electronic health record if you get that test. But truthfully, the best thing to do is to know that it's going to be 72 to 96 hours potentially before you get results. There's no easy, quick fix testing that can be done for folks unless, in time there are greater solutions coming out, I know. But for those most reliable tests, I believe they call them the PCR test, the non-clinical Angelia saying the PCR test normally is taking 3 to 4 days before you'll see results. And truthfully, I think we're probably going to get to where it's 5 to 7 days before you have results, simply because the demand is so great right now. So hang in there. If you have symptoms, quarantine. If your symptoms worsen, call your provider, and you could come in to be seen and help to manage your symptoms. But if you're simply waiting for the results, I hate to say it, we're going to have to wait a little bit.
Wow. And that is really one of the complicating factors when we're talking about these exponentially mushrooming numbers. If we had a quicker turnaround, we might be able to have people assess the situation quicker. Right now, though, your advice is sound. Quarantine if you're experiencing those symptoms that prompted you to get that test in the first place. Do you recommend people that don't have symptoms get a test?
So the tests are only as good as the day you get it, right? It's not good for long periods of time. And that almost creates a false sense of security. Oh, I didn't have it 3 days ago. That doesn't mean you don't have it now. We are in community spread in Dodge County. So I would just be mindful of, if you have symptoms, call your provider, see if you need to get tested. If it's simply a matter of, well, I think I want to know, you're welcome to use one of the facilities, but no, it's only as good as the day that you took it. And you may have been exposed before or after that. That will show up later.
Well, Angelia, I want to thank you very much for the time that you made for us today. If you could maybe leave us with your thoughts, what do you want our listeners to take away from this conversation today?
I want them to hear that I'm still incredibly hopeful that we can bend the curve if everyone does their part. I know it's uncomfortable. I hate masking too. I want to see your beautiful faces. But more importantly, I want to see your beautiful faces a year from now. It is not lost on me that 53 families in Dodge County have lost a loved one this year. And at Thanksgiving, they'll be missing them. They'll also miss them again next year. So do your part. Be supportive of your healthcare workers. Wear your mask, social distance, and please mitigate your risk by really thinking about those large holiday gatherings that we all have come to expect. My kids and I have been laughing, right? Who's to say we can't celebrate Christmas in May or June or July when it's warm, and we could do lots of different things related to celebrating Christmas. While there are traditions associated with it, the people are much more important to me than the traditions. And I hope that our listeners will do that as well. Focus in on your family and less on your risk if you're in large groups.
Well, I want to thank you very much for joining us today, and let's do this again. Let's have another update down the road here, if your schedule allows. I hope we're able to make it work.
Absolutely. Thank you so much. And thank you to the community for all they're doing to look after themselves. Everyone, please stay well.
Once again, thank you. That's Angelia Foster. She is the Chief Administrative Officer with Marshfield Medical Center, Beaver Dam. We do want to thank her for her time today. Kind of a programming note, we are going to continue this look at the situation in Dodge County on Thursday. Our guest will be Dodge County Public Health Officer Abby Sauer, who will be in to give us an update. Unfortunately, that's 48 hours from now, and we'll probably have more change in that short amount of time, but also a lot of the same things we've been hearing, and Angelia is really hoping takes root in the community. Social distancing, washing those hands, thinking twice about getting together with family from outside your home this holiday season, and wearing those masks out in the community for the support of our local healthcare workers who are on the front lines of this, battling it every day, sometimes twice a day, double shifts, split shifts, working in areas maybe that they weren't originally intending to work in, but at the end of the day, doing it so that the community can be as safe as they can. Angelia is hoping that you'll do your part to make them as safe as they can be. Again, Angelia, thank you so much for joining us on the program today.
Thank you.
That is going to do it for today's community comment.